Welcome to the second video on verbal short-term memory treatment for aphasia. Previously, we reviewed the theory behind using verbal short-term memory treatment and generalization to other tasks. In this video, we will review how verbal short-term memory therapy can be done with your patients. An important point to make here is that we are describing a set of principles to be applied to individual cases, not providing you with a formal therapy protocol. Treatment for verbal short-term memory is based on a repetition paradigm. Therapy tasks are constructed on the general framework of asking the patient to repeat back increasingly more difficult stimuli. Some possible ways to consider challenging verbal short-term memory are listed here and include stimulus variations, amount of information variations, temporal variations, and response interference variations. We'll go over each one of these individually. The first way to work on verbal short-term memory is to introduce stimulus variations. Here are some examples. At the phonemic level, non-words can be varied by number of syllables. At the semantic level, words can be varied by imageability, initially using concrete words and then moving on to abstract words. Sentences can be varied by syntactic complexity by starting with active sentences and then increasing the challenge by presenting passive constructions. The next item to consider is amount of information variations. This can be manipulated in terms of the number of words in a list or the length of a sentence. For example, once a patient is accurate in repeating a 3-word list, they may be challenged by asking them to repeat a 7-word list. Similarly, progressing from a shorter sentence, here identified as an unpadded sentence, to a longer or padded sentence will provide a greater challenge to the patient. Next is temporal variations. For those who have a too fast decay rate, treating the ability to hold on to items for a longer duration, such as 5 or 10 seconds, can improve the length of time they are able to hold on to a word in verbal short-term memory. The last type of variation is response interference. The delay between stimulus and response can be a silent, unfilled delay, or the delay can be filled with a distractor. One type of distractor might be to require the patient to identify numbers in between hearing the words and repeating the words. Feel free to combine short-term memory treatment with other therapy methods. Here are a few examples. You can combine the manipulation of response delays with cueing strategies, or you can develop stimuli tailored to your patient's individual interests, such as gardening or sports. Other ideas include spending part of your session on short-term memory tasks and part on something else, such as compensatory strategy training or caregiver training. You could also incorporate principles of short-term memory therapy into conversations by requiring a patient to respond quickly or make them wait for a certain amount of time before responding, with or without interference during that delay. And that interference can be conversational in nature, such as asking the patient to comment on a different topic before responding to the initial question. In this video, we provided you with some ideas on how to use verbal short-term memory treatment with your patients. Next, we will discuss how verbal short-term memory treatment can have a functional impact on communication abilities.